Do you have pain abdomen, diarrhea and blood in stools? This could be ulcerative colitis. I am Dr. Shubhashish Mazumdar, Director Gastroenterology in Max Hospital, Vaishali. Today I will be discussing about ulcerative colitis. Now what is ulcerative colitis? Ulcerative colitis is a chronic condition where the patients usually present with long-standing diarrhea and blood in stool. Blood in stools is a very common symptom. It may happen in many other diseases like chronic constipation, hemorrhoids, certain other piles, and it's a very commonly ignored symptom. Many of us get constipation, we bleed, but we don't go to the doctor. We try some home remedies or go to a local practitioners or even go for alternative medications. Ulcerative colitis is a disease, as the name suggests. It causes ulcers in the internal lining of the colon or the large intestine. These ulcers lead to symptoms of chronic diarrhea and blood in stools. It's a long-standing chronic disease which may have long-term effects if it is not diagnosed and treated at a proper time. Now, who gets it? Which patients develop ulcerative colitis? Frankly speaking, we don't know the cause of ulcerative colitis. Till now, science has not pinpointed the root cause of ulcerative colitis. It is known as an idiopathic ulcerative colitis. The usual causal agents are some genetic abnormality with environmental factors and certain infections, which trigger the body's immune system against its own colonic lining or the mucosa. So, what happens basically is our own antibodies are working against our colon, leading to formation of such ulcers. Now, how do the patient present to us? These are usually young patients who are in active life. They are usually in the third, fourth or the fifth decade of their life when they first present with long-standing bleeding, diarrhea, urgency. That is, they get a repeated urge to go to the toilet, but when they strain, some mucus or blood comes out. And this causes abdominal pain leading to nutritional deficiencies, fever, malnourishment. The greatest stigma of this disease is since it is affecting the active population, the young population, they go into a social recluse. They are not able to attend parties, they are not able to do their work properly in their office, they repeatedly get an urge to go to the toilet, they are always worried, will I get a toilet where I am going? So, along with these physical symptoms, this causes a lot of psychological trauma to this group of patients. So, how do we diagnose it? The patient comes to us with bleeding, maybe he has gone to different practitioners, he has tried some home remedies, he has gone to some Ayurvedic or some alternative medical treatment, then they come to us. It has got a very simple diagnosis. We do a colonoscopy or we put a camera in the colon to look at the mucosal lining and we take biopsies. These biopsies confirm the diagnosis of ulcerative colitis. Along with this colonoscopy, we have to do a few blood tests, some other investigations like an ultrasound to assess the generalized nutrition of the patient or is there any other complication associated with the disease. Once we have made a diagnosis of ulcerative colitis, we define what is the extent of the disease. That will depend on the extent of the disease in the colon. Our colon is around 5 feet long or 150 centimeters. And ulcerative colitis may involve different segments starting from the lowermost part of the colon or the rectum. It usually starts from the rectum and it continuously spreads up along the colon. So, we classify it severity according to the extent it involves. If it is only involving a small part of the colon, that is the rectum, we call it proctitis. As it progresses further, it covers the entire colon. Once a diagnosis of this disease has been made, we have to treat the patient. The treatment will depend on the symptom severity. We classify these patients as somebody with severe symptoms who is having massive bleeding, who is having fever, who is having pain abdomen, debilitated. With these patients will need hospitalization and treatment. Other patients, most of them are mild to moderate, where they are having maybe 2-3 bowel movements per day with some blood and mucus, and these patients may be treated on an OPD basis. Once we have classified the disease, we treat them. The treatment, as we initially discussed, since this disease is an autoimmune disease or the body's own immunity is working against the colon, we have to suppress their immunity. This is done by certain medications and sometimes corticosteroids are used and when they are not responsive, the next line of treatments, we give some IV medications which are given through injections. These are known as the biologicals. Some group of patients, certain patients who do not respond to this therapy may require a surgery. Surgery for treating the disease as well as some surgical complication, like sometimes in severe diseases there may be a small hole in the colon leading to some infection, and these patients require surgery. So once a diagnosis has been made, the patients are treated and most of them respond. There are two parts of this treatment. One is the induction phase, where we suppress the severe disease, and when the patient is better, he is kept on a maintenance treatment. This maintenance treatment usually goes on for life, for a long term. Ulcerative colitis is just like any other chronic illness like diabetes, like hypertension, where the patients need long-term medications, oral medications on an OPD basis. If required, we only admit them if there are certain complications or exacerbation of the disease. We never use the term cure for disease. We use the term remission or exacerbation. Exacerbation is when sometimes the disease flares up. What can flare up the disease? Certain drugs, certain painkillers, some viral infection, some other infection which may cause a flare. We treat them and they come back to the baseline, which is known as the remission. So once the patient is in remission, he is on oral medications which continues for long term. What are the complications of disease? The most important complication, as I said, I feel personally the most important complication is a social withdrawal of these patients. Young active patients who usually goes back into the shell, he is never going out of the house. So one of the vital part of our treatment is a psychological counseling. We must talk with him, they must come out. Many of our patients, especially female patients in the rural area, they are hesitant to come out with these symptoms of bleeding per rectum. They usually hide it for long and they present to us in a severe form of the disease with severe anemia, low hemoglobin and in a debilitated state. So the most important part of this disease is if anybody is having such symptoms which is not improving with some medications or initial treatment for a week or two, they must consult a concerned specialist and get a proper evaluation done and treatment. The other common complication we see is surgical complications. That is, because of the severity of the disease, there is some leak in the intestine, there is some severe infection which may require a surgery. The most dreaded complication of ulcerative colitis is colon cancer. Whenever this disease is there for long term, that is more than 8 to 10 years, there is a propensity for these patients to develop cancer. Almost 2 to 5% of chronic ulcerative colitis patients may go into this. The simple remedy for this is we do routine screening colonoscopies. Even if the patient is in remission, one colonoscopy every 2 to 3 years to detect an early cancer, pick it up so that we can treat it. So I will say ulcerative colitis is not uncommon. It was earlier considered to be a disease of the West, but now we are seeing more and more patients in our country. One, because of the awareness, because of better diagnostic facilities and availability of better treatment. Nowadays science is evolving and we are getting newer molecules, newer research has brought out medicines which can be taken orally, injections can be avoided. Now the frequency of doses is also less. So long-term medication will help in preventing the progression of the disease and developing of these dreaded complications which may require surgery. Lastly, I will say ulcerative colitis is not uncommon. Earlier it was considered to be a disease of the West, but even in our country we are seeing more and more of it. So if you or any one of your loved ones, dear ones, have symptoms of long-standing diarrhea, mucoid stools, blood in stools with mucus, pain, abdomen, weight loss, one should not ignore these symptoms. Consult a specialist, get a proper diagnosis and a proper treatment, which will help them lead a healthy life. Lastly, I will say this is a disease of the young and it causes a lot of psychological trauma to these patients. So a diagnosis at a proper time and treatment will help maintain a normal life and prevent the long-term complications of this disease. Thank you.